Hello, my name is Dr. Aaron LeBauer with LeBauer Physical Therapy in Greensboro, North Carolina. Today, I'm going to teach you how to perform self-myofascial release using a Theracane to treat your body where you have pain, discomfort, or tension. Myofascial release is a very safe and gentle technique that combines sustained, gentle pressure and stretching. You can use a Theracane to target specific areas of your body to release the tissue using myofascial release techniques. When you're doing this, you want to use the Theracane directly on the skin. Even at home, maybe take your shirt off to do these techniques. I'm going to demonstrate on top of my shirt, but what I want you to do is get the Theracane directly on the skin so you can get almost a good skin lock or engage the muscle and tissue so that you can wait without sliding for up to 3 to 5 minutes for the tissue to let go. One of the most typical areas that people have pain and tension is the upper shoulders, neck, and scapular area. So you take your Theracane with one hand at the bottom and one hand on this projection, using it almost as a pivot to engage the tissue and find the tender areas. And when you find the area that's the most tender or painful, get it right on the skin, and without sliding, just let the weight of your arms provide the pressure. And without forcing, wait here with your eyes closed, breathing into the area for at least 3 minutes, if not 5. When you're ready to move on to the next area, you can work a little bit lower down your back, right around the scapula. There should be some nice trigger points there. And again, find the area that's the most tender or tight or tense. And without sliding over it, without rolling back and forth, just engage the tissue and let your weight of your arms do the work. If you feel like you're working too hard, you probably are. You can also get this projection here into your neck, which is a really nice way to do it. And you have one hand at each end, and I can pivot and adjust my pressure really gently and really easily here. You can also work into your jaw a little bit, if you especially have jaw tension, pain, or TMJ problems. The pecs are another really important area to work on, especially if you have head, neck, shoulder issues. So you can use this projection again to work on your pecs. And if you can, you get it right on the skin and let this arm go. And it'll lock into the skin, and you won't have to do a lot of work to hold it here and wait for the release. Other really common areas people have pain and discomfort is the low back. So you take your Theracane and you bring it around your low back, and you kind of provide a little bit of pressure in this direction with your same side hand, and I'm controlling the direction with this hand at the end. You can also switch around here. If you have hip issues, this is a great one to do on the couch. You can let the Theracane slide down into the couch, and you sit on the nub here, and with this kind of in the back of the couch, it'll get a little bit deeper, and you can really control where the Theracane engages your hips and your glutes. Again, spend 3 to 5 minutes in each area that you find is really tight, tender, or feels like it's a really good spot to work on. Other areas of the body, legs, you can use these little tiny knobs here for your quads. So you just find that tender spot and you hang out and wait. And without pushing, just let the weight of your arms do the work. For anyone who's a runner, the anterior tibialis here, this is where people get shin splints. Sometimes this will refer into the foot if you have top of the foot pain. You just find the tender area and you hang out and wait. And do this right on the skin. It's also a great position to use on your hamstrings. And you can use the flat part on your quads. And then anywhere in your body where you have pain, discomfort, or tension, you may have to be creative, but you can find a position that allows gravity and the weight of your body to get the release that you need without forcing it. Sometimes you'll feel sore afterwards. Sometimes you'll feel great afterwards. That just means you're getting into the right areas. I hope you enjoyed these self-treatment techniques today. If at any time something doesn't feel right, you have my permission to stop. If you feel that you need additional advice, please seek an evaluation from your local physical therapist. To learn more about our practice, or even to get a free newsletter or book on low back pain, visit our website, lebauerphysicaltherapy.com.